Carolina was diagnosed with bilateral breast cancer at age 39, and now she's turning to ChatGPT for guidance, especially when her doctors have to make a choice about how to treat her cancer. So far in her journey, there are two hurdles that ChatGPT is proving to be of particular help.
The first one was understanding the pathology reports, biopsy reports, pathology reports, scans. For me, specifically, I want to understand it thoroughly. I want to dissect it. I want to understand every word that it says in there.
The second most helpful are what she refers to as the gray areas.
Because of my diagnosis, because of the level of lymph node involvement that I had, it kind of fell within this really gray zone of whether you could follow this treatment or that treatment. And the doctors were very clear with me that this is a gray zone that we're in. So we kind of have to pick, which side of it to fall.
A decision had to be made, and it was not easy.
We ran into a couple of roadblocks. And so at the end of the consultation, we decided to go a different route. But I left that and it just didn't sit right with me. I just had questions still about it.
She once again turned to ChatGPT to get a better understanding. Ultimately, she felt more comfortable going a different route.
Then it actually coached me on how I should bring this back up with my doctor. So after it coached me on how to have this conversation with my doctor, I went back and my doctor agreed that we were going to go back to the original plan. That moment was really, incredible.
Carolina is sharing her story before completing treatment, so she's still actively using the deep research model as she navigates next steps. That includes whether to receive radiation after 6 chemotherapy treatments.
At the end of the day, it doesn't spit out a very clear decision, this is what you should do. But what it does is that it gives you enough information where you clearly understand what are the benefits, what are the risks.
A lot of people are uncomfortable sharing personal information with an AI. I reached out to my friend, Dr. John White. He's the Chief Medical Officer of WebMD, to see what patients need to consider. I also posed that question to Felipe. Follow along for part 5 for their responses.